Hello everyone, I'm Dr. Darsh,
And I'm Dr. Altamash Raja,
and welcome to Medicine Redefined,
a podcast where we will explore the often overlooked but necessary components of health, what we consider to be the fundamentals.
We will investigate topics and practices that can give you and your patients the best chance to optimize a healthy lifestyle. It's time to move the needle forward and put the health back in healthcare.
Before we get into this week's show, here's a quick word from our sponsor for this episode, Panacea Financial. As a company founded by doctors, they know how frustrating it can be to work with financial companies, which is why they've created a better way. Have you thought about refinancing your student loans? Well, unlike other companies, the rates you get at Panacea Financial for student loan refinance doesn't go up because your credit score, how much debt you have, or your income level. With no loan maximums or cosigner requirement, their student loan refinance is based on the respect physicians deserve and not a credit score or debt level. Join the growing number of physicians nationwide that expected more from their bank and switch to Panacea Financial. You can visit panaceafinancial.com today for a better way to refinance your student loans. Panacea Financial is a division of Primus member FDIC. All right, guys, we have been privileged to have some amazing guests over the last couple of weeks visit our show, Dr. Giselle Aerni and Dr. Gerard Malanga. With Dr. Aerni, we had a powerful conversation talking about gender disparities in sports and in medicine. We followed that up with a more scientific conversation and talking about the specific differences and how women can train, considering their hormonal differences, exercise in pregnancy. We talked about some specific medical and biomechanical injuries that female experience, particularly related to sports medicine and musculoskeletal medicine. And we also talked about social disparities in medicine and how they influence how we practice. With Dr. Malanga, we visited the field of orthobiologics, and we talked about the differences between PRP and cellular treatments and prolotherapy, and talked about why words matter and how we have to be precise with what we're talking about. We have to practice evidence-based medicine, but most importantly, how we can employ this into our practice. So today, Darsh and I are going to revisit some of those things, talk about our perspective and the insight that we gained, and perhaps some things we'll share with you that you might not have thought about. So without further delay, please enjoy this Lessons Learned episode.
All right, hello everyone. Welcome back to another Lessons Learned. We haven't done one of these in a while, so this is a fun thing Altamash and I like to do, and we love to share our perspective and our lives. And of course, with the new format that we have, given the 3 episodes of the guests and now this 1 episode of the Lessons Learned, we're definitely looking forward to it. And in this one, we will be recapping and going over the things that we learned with Dr. Giselle Aerni and Dr. Gerard Malanga. Altamash, how are you, man?
Doing wonderful, buddy. How are you?
I'm fine. I'm doing great.
You know, it's Memorial Day weekend, and the last couple of weeks, it was humidity, and it was hot, like 85 degrees, and then today it's been the 50s. I don't know
50s and rain.
Yeah.
Man.
Although I have been somewhat grateful for the rain for the last couple of days. I got a car that's like this deep midnight blue, and with the pollen, it was just, black cars. I don't know what color your car is. Like, it really shows. And I was like, God, freaking A, man, I got to get this car cleaned. And with the rain, I was pretty happy with that. So, that's a win.
Nice. I feel you, man. Yeah, I got a silver green Honda CRV. So sometimes I get the same problem.
Depends. I heard that. So, dude, cool, the last 2 episodes, Dr. Aerni, Dr. Malanga, 2 powerhouses. I mean, some drastically different topics that we discussed. But super important, right?
Right.
Popular stuff that's going on, on the minds of a lot of different people, a lot of questions that people had, particularly on this quote unquote regenerative medicine topic that's hot right now. And so excited to get into that. So where do you want to start? You want to start with Dr. Malangas, or do you want to start with Dr. Aerni?
Let's do Dr. Aerni. You know what's interesting? Both sports medicine physicians, 2 completely different topics.
Yeah,
which is super cool to think about. But let's do Dr. Aerni. So we kind of talked about women empowerment, right? Was the central theme of that part 1, and the gender disparities that we're seeing, not only in the hospital, not only in sports, not only in politics, but just almost in everything around the world. What are some of the things that stuck out to you?
Over the past year and a half or so, this topic of disparities has been at the forefront of everybody's mind, right? It's not new, but we're paying
Right.
a lot more attention to it today with everything that's happened over the past year. And so something that you and I have a difficult time appreciating is kind of the subtle day-to-day difficulties and the disparities that they experience, our women colleagues. I mean,
Hmm.
I've told you some stories. I shared some stories on the episode with Dr. Arnie, but also some stories offline that my wife tells me on a daily basis, something that it's hard for me to appreciate. And even though I vicariously kind of am hurt through her, it's not something. It's still hard unless you're the actual person going through it, right?
Yeah.
And there's just the things that she had talked about, so many subtle things like not getting the same shape coat, right?
Hmm.
Not getting the appropriate clothing, or not getting the funding at the Division 1 level, at the collegiate level. We talked about the NCAA debacle quite a
Hmm.
bit. It's been so pervasive for such a long time, and it's frustrating because change does take a long time, but this one has been overdue, right?
Yeah, absolutely.
And the biggest part, this isn't the biggest because there's so many components to it, but the whole concept of, hey, like, you and I have to continue to be advocates for them, right? Dr.
Hmm.
Arnie is of course being an advocate. This is what she's doing awesome. At this point, all her, not all, but most of her courses have launched already. So she's got a lot of people signing up for that, and she's going to, empower them and teach them and mentor the next generation of physicians to not go through the same bullshit that she went through.
Right.
But that's just not enough, man. Like, you and I
Yeah.
have to continue doing that. And luckily she gave us some great tips on how we can be advocates, how we can be sponsors for our female colleagues. Do you remember what
Yeah.
those were?
So, I mean, one of them for me personally, actually, I'll talk about is like at Penn State here, we have a women in medicine group, right? But
Mm,
how many men are actually part of that? How many men are actually going to those meetings? How many men are actually trying to contribute with information and share the links? It's a women's group, and I get it because, like you said, it's tough for men to appreciate what women go through,
mm-hmm.
and it's easier to make a bond with someone who goes through the struggles that you do, but that doesn't mean that we can't contribute in our way. We can't go and listen, right? So sticking up, at least for me in the hospital, in terms of when a patient makes a comment to a nurse, about being attractive, right? Attracted to them. Or I've heard this from my co-interns themselves when a code happens or rapid, they feel like they have to be more authoritative just to take control of the room, right? Those kinds of things, those assistings, being aware of the noise in the room and people's emotions and kind of setting that record straight, so to speak, I think is something in medicine, at least, that I'm more aware of now. My co-intern today actually was telling me that she feels like she has to be overly nice through texting nurses and texting social work just to get things done. And
Mm.
I've been a people pleaser myself my whole life, and she's like, yeah, but it's different for women in that regard, because she feels like they do it to get things done. And so it's definitely interesting, and like you said, I mean, it's long overdue. And I'm not here to say this change is going to happen overnight, right? Because I think we all grow up with schemas in our head. And there's this one riddle that people might have heard, and I'll share it here. And so it's a boy and a father are in a car driving on a windy road during a rainstorm, and the car crashes and the father dies. The boy survives, and he's transported via the ambulance to the operating room. The surgeon walks in and says, "Oh my God, I can't operate. This is my son." Right? And for the listeners out there, you guys can pause, think about it, what your answer is, and I'll share the answer here in a little bit. But the surgeon's his mother, right? It's a schema that we have, that a surgeon's always a male, right? So it's one of these gender biases that we have kind of growing up, right? When we think of a surgeon, even we think of them with the mask, right? And this is getting off topic, but even the data for like mask, you don't need to have a mask in the OR, right? Is what the data have shown since like 70s, 80s. So we're stuck with schemas, and we kind of keep those schemas in our head as we go through different avenues of life.
Yeah. One of my friends, we were having this discussion actually before we even, Dr. Arnie came on and kind of got some thoughts riled up in my own brain. One of my friends asked me, like, how does, what would be your advice to help do that, to kind of break that mold? Like you mentioned your co-intern, to communicate effectively and get people to kind of treat you with the quote unquote same respect. And my immediate answer was to project confidence, right?
Mm-hmm.
But here's the issue that Dr. Aerni talked about, right? Is that if a woman does that, then she's viewed in a different light, right? Whereas male is like, okay, he's bold, right? I mean, I think she gave her own personal experience with a pharmacist, I think it was, where he was considered to be a great leader and, taking charge and all those things. Whereas if she had done that, or if a woman does something like that, then it's like, okay, you're not a team player, right? You're stepping out. And again, so much easier for me to have given that advice at the time, but I've never been in those shoes where somebody's like, wow, what's wrong with you? Why are you so selfish? Or like, why are you bitchy like that? Right. And I don't know there is some good to that though. Let me give you, a couple of years ago, not a couple of years ago, I guess a couple of years ago, when I was in medical school, I remember working with a surgeon, and this guy, I was a third year medical student, and old school mentality, 20 something years, immigrant, European, not that has anything to do with it, but just old school. And he was giving me an example on this one student, like basically just saying, us students, like our mentality is different. And he was kind of venting and complaining about the student before me, how she kind of made his life difficult, because I don't know exactly, I forget the details, but the essence was that he had made some comments about her physical appearance to her, about what she had worn. And what he was looking for was acknowledgement that she was in the wrong, right? And he was like, yeah, isn't that so ridiculous? And at the time, I just gave one of those nervous chuckles and I laughed, but I didn't pause and say, no, bro, like that is beyond inappropriate, And I think about that is that would have been a perfect opportunity, right? But this goes back to what she talked about is, when you're a trainee, right? When you're a resident, you're a fellow, you're concerned about the repercussions, Another example is this actually happened during my residency time, where one of the physicians in the leadership position had talked about, I think one or two people in the program, not my current program, actually one or two people in the program had gotten pregnant. And this person, this attending, had made a comment about how, these girls, like, they shouldn't be getting pregnant because that puts a burden on the residency program. Like, in terms of finding coverage. I mean, it is challenging,
absolutely, right?
Yeah.
I've heard that multiple times. Yeah.
And in my mind, I was like, bro, you can't say that. Like, you can't even think that. Like, what? I was like, no, that's not okay.
Right.
But again, I didn't say anything. And, I wish I had. But again, you don't beat yourself up for it, right? You look forward and you see where you can make those changes. And this again goes back to the point that now that I'm a little further removed, I'm closer, 1 year closer to being an attending, 1 year closer to be, it's a little bit easier to kind of advocate for those people, right? For your colleagues, especially the ones who are medical students, who are residents, who are on the bottom of that totem pole, who are terrified to say stuff. And they're the ones who are being taken advantage of the most. Yeah.
Yeah, absolutely. Absolutely, man. And I think the other idea that Dr. Aerni had was, well, let's take it back to when we were talking about the whole NCAA debacle. And, I didn't really hear about that, or even the foul call that happened in the Baylor UConn game, which is a huge deal, until LeBron James posted it. So it took a big celebrity athlete to post it in order for, whatever, ESPN Sports Center and Instagram just to highlight that. And, Dr. Aerni said, well, I heard about it right away. And, I said, oh, well, how? And she said, well, I'm following people that follow that, right? And you're not. And I was like, oh, that's very true, right? I'm following the mainstream. And one of the things that we can do is follow people who, quote unquote, don't necessarily, I don't want to say align with our ideas, but maybe have a different perspective than we do, right? And it doesn't even have to be about gender disparities. Just having a different perspective in all realms of life help you to figure out kind of your perspective, right? On the right side, on the left side, the black and white, the gray area. And I think that's how we learn and educate ourselves and become more comfortable with learning a topic, right? And learning especially a topic like this where we see it so often, but we don't know how to approach it. And so the more we see kind of the empowerment side of things, the more examples we see, the more mentors we can collect that are doing these types of things, it gives us more power to kind of be that next person to kind of pass the torch down.
Yeah, you can become intellectually well-rounded, right?
Yeah.
So you start following people who don't necessarily look like you,
Mm-hmm.
different gender, different race, different religion, get their perspective, right? It's again, yeah, like you already said it. It's so easy to kind of just agree and nod and agree and nod, and we've talked about this offline. Is sometimes I'm working on this actively in my life where I'm trying to have more conversations and look at the other person's perspective, somebody who I don't agree with, because that's where the learning happens.
Yeah.
Right? If you and I, and there's not everything that you and I kind of see eye to eye on, and we have some different perspectives. So most things do overlap. But if you always just hang out with the same inner circle and everything that you guys agree, then nobody's going to challenge you. You're not going to grow. So that's another reason too. And yeah, since then I've actually made it a point to try to go follow people who in the past I would have been, no, I got to cut that out. I got to cut it out because, sometimes you get so much unnecessary stuff. So we've talked about social media, how it can, it's already a problem. I'm on the fence about that. I still haven't figured out which way to go, but if I'm going to be on there, I do think that's really, really important. So I think that the ultimate takeaway in terms of immediately, what I would encourage my male colleagues to do is, in terms of being sponsors for females, is something that I think that I've done a good job with in my role as being a chief resident here in a leadership position, is to kind of, some examples that she gave were that, if a woman is in a meeting and she says an idea, then a guy will repeat it immediately after. You can just pause, you can interject because culturally that's appropriate, quote unquote, and say, oh, well, I'm so glad that you agree with Dr. Arnie's idea, right? Or, hey, actually, they were wrapping up a thought. But, sometimes even I've worked with so many brilliant women that because they've had these experiences throughout their life, they don't speak up, even in large meetings, even though I know that they have amazing ideas because we've talked about it in a one-on-one positions, but they don't speak up, or they'll apologize if the other person misinterpreted. And it's not like they gave offense. It's actually Max Schenck says that you can't ever give offense, you can only take offense, right? And so they have to, oh, I'm sorry, that's not the way that I communicated. Well, no, like, you're good. I understood the way you said it. And so highlighting, saying, hey, like, this person has a great idea, and try to do the best possible. So those are some things that I'm going to continue to work on. And anything else that I missed that you got?
No, man. No, just to the listeners out there. I mean, you can hear us say it, but it's way more powerful listening to this whole speech and this whole topic from Dr. Arnie. Episode 12 was super powerful. So I just recommend anyone listening to this who hasn't heard episode 12, go back and listen to it. You will not regret it. So yeah, I definitely think it was awesome.
And actually, another thing that was really awesome is, again, going back to the idea, hey, there are some actionable tips that we just talked about that we can do immediately, but also long-term scale, right? Being optimistic. We're looking at the 10-year, 15-year plan in the culture of medicine. And just even outside of that, she gave that terrifying anecdote that when she was doing a hip injection on a patient and how they made this inappropriate comment, and she called them out, right? She nipped it in the bud right there. And she said that, 10 years ago or 15 years ago, she wouldn't have done that because she did this when she was attending, and only until she got further in her career that she felt comfortable enough to be able to do, make a stand like that. And I remember asking her, how did you get there? Or like, what recommendations would you have for current trainees? I think that, unfortunately, the answer wasn't as satisfying, because you do have to buckle up. This is going to take a long time, which is why we're going to keep advocating for it. But what was beautiful about why she could dial it in and she could push forward now is because she said that she had her finances dialed in, and she was like, you know what? I don't need this shit anymore. I can step away. personal finance is a big thing of mine, and I keep advocating for this as well because, again, student loans are on the rise, right?
Mm-hmm.
And we don't make good financial decisions. So we've got a guest coming in the near future to talk about, making sure that you dial that in.
Yeah.
So when this kind of stuff happens, it doesn't necessarily have to be disparities for the opposite sex, but other stuff. If you don't feel fulfilled by your career, whether it's professional satisfaction, if you don't see eye to eye with your employer, right? There's lots of things in medicine that happen that, even outside of this topic, that if you don't agree and you've got your finances squared away and you're not hamstrung and you don't have to pay, student loans, and
Mm-hmm.
you, you don't need it.
Yeah.
So, all the more reason not to make stupid financial decisions at a young age in medical
Mm-hmm.
school and undergrad, and more to come on that soon.
Yeah. Yeah. Absolutely. Cool. Well, let's move on to episode 13, which is again with Dr. Aerni. So this is the part 2 that we had with her, but transitioned a little bit more towards women, female health, and exercise. So kick it off, man. What'd you take away from that?
Yeah. So here was the first one was super powerful, but this was the nerdy part of us coming out, right? We're learning about
Mm-hmm.
different female specific training, female health. And, one of the first topics that we talk about are ACL injuries
Mm-hmm.
and how it's, an endemic, right? We have early sports specialization. That's a big thing. But females, she said, are anywhere from 2 to 8 times more likely to tear their ACL, even though I think on a global scale, men tear their ACL more, but that's just because they participate in more sports than women do.
Mm-hmm.
And so she did a beautiful job mentioning for all the reasons that might happen. Some of them were because of bioanatomical reasons. Other
Mm-hmm.
were because of ligamental laxity and hormonal differences, but also not in improper training. And so we're working all those different types of things. But the newer concept, the REDS, which is relative energy deficiency in sport, right? Historically known as the female athlete triad, was something that she did a great job explaining as well. And what was interesting about that is I did not know that this was the first area where women were specifically targeted for research. Makes sense.
Mm-hmm.
But I thought that was pretty interesting that, again, it just goes back to the kind of women are not tiny men, as she mentioned. So we can't just
Mm-hmm.
extrapolate the data that we get from, taking from 18 to 22-year-old collegiate males and say, oh, this is how women's sports are going to participate. And these are the issues we're going to see. And this is how we gear their training. So got to do more research for your target population and then get information about that, right? Because their physiology, because of the hormonal differences, is so drastically different. And we understand very little about that.
Mm-hmm. Mm-hmm. Yeah, absolutely. I mean, I think that's one of the more hotter topics of recent is, people who look at the academic research saying, how does this data actually even make sense for my own patients, right? Or a certain population. And I think we're starting to see like, hey, we need more research on women. We need more research on actual healthy people, not just a set of people who have disease, 40 to 75, male, white, right? Which is like the most generic as we go in research. So yeah, I mean, that was super interesting. And I think when she mentioned about training and improper training, I know from high school for myself, I played about 2-3 sports. The guys would always be in the gym doing weight training. It was emphasized, whereas the women would be out practicing, right? Just their sport, but there was no supplemental, weightlifting or exercises or, any kind of training that I noticed. So it was very interesting kind of to just see that. And then she goes on to kind of give some stats, which, I can't recall off the top of my head, about how often females will forego a sport if they don't play it by a certain age, right? And so if you don't play it by 10 or 15 or by, the time you turn into an adult, you're less likely to work out for the rest of your life, which I found super interesting.
Yeah, man, I wish I remember exactly but I know that it was big.
It's high, yeah.
Yeah, it was super, super high. So definitely worth getting them involved at an earlier age, and which is why I it's funny because people always ask me. I mean, football is my favorite sport, and people always ask, "Oh, so are you gonna get your child to, or your son or whoever, or even your daughter nowadays to play football?" And just because I'm a physician, sports medicine, concussions, that's hot, as you already know.
Hmm.
And my answer was no. I mean, I would love for them to play some sport and whatever they're going to be happy with. But yeah, that's going to be a big part. I mean, because again, we can dive into all the things it teaches you doing some type of activity and the discipline and putting the work in. But but getting them involved at an earlier age.
Yeah.
And it's all about modeling, right? If they see you be active, they're going to be active as well for that reason. And then just going back to the hormonal and physiological differences between men and women, right? I mean, she talked about, she cited a couple of studies. One with McNulty was a great review that came out, looked in exercise performance and the effects of menstruation and in different phases of the menstrual cycle. There was actually, we've talked about nutrition a lot. There was actually another paper published this year in the International Society of Sports Nutrition. It was a narrative review looking at it was basically giving sports or nutrition tips for active women, which I thought was really good. I recently I think, I don't know if I sent it to you, but if not, I will. I mean, matter of fact,
Hmm.
it's an open access review, so we'll put it in the show notes here.
Yeah.
But there were 4 key points from that as well. Again, highlighting the differences for men and versus women, and talking about how, key point number 1, that the menstrual cycle obviously correlates with changes in macronutrient metabolism, right? And for those who don't know, macronutrients are basically proteins, carbs, and fats, right? And on a basic level, like for instance, depending on what phase you're in, like in the follicular phase versus the luteal phase, in the follicular phase, your fat oxidation is going to be decreased, your protein oxidation is going to be decreased, your carbohydrate oxidation is going to be increased, and your glycogen storage is going to be decreased, right? So that's important to understand because, depending on what phase of your menstrual cycle, you might want to again, this is all relative. It depends on how high level one is competing at. But for collegiate to professional athletes, these are important things to understand. And I'm confident actually that dietitians and sports nutritionists understand it. Actually, I learned about this from Angie Ash, and a huge fan of her. I think she has Elite Nutrition on Instagram, and I don't know if she has Twitter or not, but I highly recommend follow her. And she's a great nutritionist that she talked about this. So the second point from that is, again, different specific macronutrient needs can depend on, again, phases of the menstrual cycle. So they also give some recommendations on, how many grams per kilogram per day, how often women might want to feed. Again, this can be individualized to every single person. But, they talk about different supplementation that you might want to take as well. So it was a really, really good review. We'll post in that.
Yeah, super, super interesting.
Yeah, for sure. So switching gears, man.
Yeah.
Obviously, we've talked a lot about training. Now, this is a interesting topic about training and pregnancy, right?
Yeah. Yeah.
What I'm curious. What has your experience been? Have you seen any women in clinic who are pregnant in your life, whether maybe in your family or inner circle, people who have gotten pregnant? How have people treated those individuals who've gotten pregnant?
With caution, I would say.
Say more about that.
More, it's more so watch your step, watch where you're moving, watch where you're going. Everything, you essentially treat them like a robot when they walk, right? Like there's that lack of flexibility, that lack of mobility. You're not letting that person move and be kind of who they are in a sense, right? I think you almost treat that pregnant woman, I don't want to say as an outcast because you're very attentive to everything they do, but as brown culture, it's very like, okay, let's protect this woman, right?
Mm-hmm.
And
Put a
in a
bubble around them.
way, right, put a bubble. And we talked about how important it is to exercise pre-pregnancy, during pregnancy, and how that helps post-pregnancy. But I feel like so often we're told these old wife tales like, hey, when you're pregnant, just like make sure you eat a lot so the baby gets food. And I've never heard anything about exercise. Never, not once.
Yeah, they're like this. It's a delicate. I mean, it is a
Right.
sensitive period, right? I mean, you're growing another human inside you. I get that,
Hmm.
but again, the body is a tremendously complex and phenomenal thing that there are protective mechanisms, right? The body is
Yeah.
adapting and accommodating this this life form inside, but the person can continue on. I mean, there's ample amounts of evidence supporting that it is safe.
Hmm.
But again, this goes back to Traditions take time, man.
Yeah.
Especially bad traditions. It takes time to kind of break them, to outgrow them, and it's incredibly safe to do. And Dr. Aerni mentioned all the reasons it's beneficial, actually
Hmm.
healthy for the mom, healthy for the unborn child, right? And just to
Yeah.
recap some of those, we talked about decreased pain throughout, afterwards,
Hmm.
right? Better tolerance of GI distress. Okay. And not many people want to talk about it, but you know what? Nausea, constipation, bloating, those are very real things you can imagine. You can
Hmm.
imagine that if there's something in that region, like it's going to be hard to pass stools. Hey, we
Right.
got somebody coming in who's going to talk about how important it is to have bowel movements, right? Because we don't want to talk about
Absolutely.
that. But when it comes to our gut health, you have ligamentous laxity because you need to, your body needs, you need to be able to push this thing out. And so they're getting softer. We know that strength training is phenomenal for providing stability.
Hmm.
I would say, again, I don't want to say 100%, but pretty darn close to 100% of women have experienced back pain during pregnancy,
Oh yeah.
right?
Absolutely.
How do you
Yep.
counteract that? You provide
Yeah.
more stability around the SI
Hey.
joints, the ligamentous stuff, right? Again, it's all about, like, you and I have learned tons of treatments when it comes to manual therapy about making them more comfortable and treating them after the fact. But if you can do it
Yeah.
through exercise, and that's going to stick longer afterwards. And I haven't even touched on the quote unquote medical component of it, right? The better control blood pressure and plasma
Yeah.
volume and reduce risk of diabetes, not only for yourself, but also for the child, right? Glucose metabolism
Absolutely.
being regulated is a super important thing, right? And then that is a chicken or egg thing with obesity that we've talked about a billion times on this
Hmm.
show. So, I mean, sleep, better quality
Sleep.
sleep. Yeah, sleep
Hey,
is a very real
clots.
thing. Insomnia during pregnancies are a very real thing, right? I mean, so many
Yeah.
women complain about this, is especially as they get to closer to the second trimester, is when the morning sickness stuff stops stopping and your belly's getting bigger, it's getting harder to sleep at times. And
Absolutely.
obviously,
And there's
every
so
single
much.
woman, yeah, I mean, every single woman has a different experience with it, but I mean, these are all well documented. And so,
Yeah.
it is safe to do. And you know what? It's so safe that there's a whole task force for exercise in pregnancy. Actually, there's exerciseinmedicine.org is a great, I think that's what it is. Is it exerciseinmedicine.com?
That's an exercise
.com?
medicine. Hmm.
Exercise, no, it is exerciseinmedicine.org. Yeah, yeah, absolutely. Exerciseinmedicine.org, and they have resources for pregnancy in there, and they have it for all kinds of they call it quote unquote special populations, or like for people with Alzheimer's and brain health
Yeah.
and people with diabetes. And we'll put it in the show notes here for people to see. But both cardiovascular exercise and strength training is safe to do. In fact, recommended. But this is
Love
not
it.
medical advice, though. So please
Love
do
it,
talk to your
right?
doctor.
And for our medical students pre-meds, right? What are you guys going to be learning about? Virchow's triad, right? The clots that you can form, the DVTs, and then the mental health issues that we see with pregnancy, right? Depression. And I've talked to so many pregnant women that are like, almost every single pregnant woman is depressed. Like they won't talk about it. They won't say anything. They won't even know that's what it is. But at like post-pregnancy, they'll look back and be like, wow, like I was depressed. Like, yeah, like I was sad. That took a toll. And we know, hey, exercise is one of the best antidotes for that, right? In terms of getting the serotonin, the dopamine, and all that. So yeah, a lot there that we're definitely advocating for.
Yeah, and just I know I'm kind of being a dead horse here, but you know how I feel about exercise. But
Yeah,
honestly, even the postpartum period, right?
yeah,
You have the carryover into postpartum period, and again, you're more likely to do it, get rid of the weight faster. Um, if you exercise in pregnancy, you're more likely to carry that on because it
hmm,
becomes a habit, and that postpartum period is going to be much easier too.
absolutely, absolutely, very
Awesome, man.
cool. Cool. One of the things I wanted to bring up was, we touched on the barriers to exercise, and I think this is very, very important for the listeners who are definitely trainees, but also patients, right? Because I'm always telling patients to advocate for themselves, and too often I
Hmm.
see patients not speaking up for themselves. But barriers to exercise, right? Like for us, we're always looking to teach our patients how to exercise, the frequency of exercise, but being a physician, you're most likely going to be in a privileged position, right? Where it's very easy to exercise either on a daily basis or to get equipment or whatever, right? We don't have many barriers of resistance, as Dr. Aerni states. But the person across from us may, right? especially women, and you're in Baltimore, so you definitely know this, right? Inner city, not being able to maybe get out of the house for a walk, even the parks, I mean, I'm from Philly. I've seen parks filled with needles all around. Um, yeah, let's go into that for a little bit.
Yeah, that one was humbling because, as I mentioned, I first heard about her talk about it with Dr. Leisha Carter on her own show, and then it happened to me. It actually happened to me where I
Yeah.
was doing a procedure, and a patient was like, "Yeah, it wasn't safe, but now I can finally exercise." And I was just like, "Man, I can't believe I never talked about that before." And it's really just comes about to meeting the patient where they are, right?
Right.
Uh, this goes back to what we were talking about the other day in terms of context. It's key,
Mm-hmm.
and you can't just say, "Oh, hey, you got to exercise." How, where, when, why, all these things matter, right? And if you really care, if you really want the patient to do well, not just so you can document and say patient's non-compliant if they're not exercising, or they're not taking their medication or whatever it is, you got to meet with the patient where they are. So that is so important, and the social disparities component is something that we don't think about. I recently read some variation. I'm paraphrasing because I don't remember the quote is. You talk about privilege. One could argue privilege isn't just having, opportunity or the luxury of something, but also the lack of adversity in life.
Adam Grant, Work Life.
Is that where I read it?
I
Some
think,
version of that?
yeah, I heard it on there. Yep.
Yeah.
Yep.
Yeah, man, that's something to think about. And I thought about that for a second, and I was like, wow, yeah, because I mean, traditionally, that's what we think. Privilege is like, oh, you've got nice things and blah. But
Mm-hmm.
also, if you don't have barriers in life, you're
Yeah.
also privileged in some sense, right?
Privilege.
If you got food on the
Exactly.
table, which just so
Yeah.
it really, really important to think about. Yeah, I agree. Like if you were a physician, you're going to be privileged of some sort,
Yeah.
for sure.
Cool. Cool. I just want to mention real quick the books that Dr. already mentioned here, because I've read two of them myself, and the third one I need to read at some point. But the first one she mentioned was Mindset by Carol Dweck, right? So for those of you all into like the personal development, self-growth, even just trying to become a better version of yourself and cultivate that mindset where you look at, I guess it kind of is like Ryan Holiday with Stoicism, right? It's taking every hardship and looking at it from a positive perspective. So that's kind of the first book. The second book is Grit by Angela Duckworth, which I absolutely loved. I actually referenced this in my TED Talk because it was that powerful in terms of figuring out your passion and purpose in life, right? And a lot of that takes from going through different experiences. And this third one, which I haven't read, is Untamed by Glennon Doyle. And she actually has a new podcast out, Glennon Doyle does. But I've heard very great things from a lot of people about that book.
I actually listened to, I think I told you about Blinkist, right? Where it's kind of like bite-sized versions, about 20 minutes, highlights of Untamed. Really good. I actually highly recommend it.
Okay.
So yeah, I did enjoy that too. I might have to pick up the book, but man, that list is getting longer and longer. I love it though. I kind of have to put things on a pause here as I start my board prepping, but
yeah.
All right, man, let's shift gears, right? Because we've been going a little longer than we wanted to.
Yeah.
So Dr. Jerry Malanga visited us recently, and we talked about orthobiologics, or quote unquote regenerative medicine.
Hey, amazing.
So let's start there, man. Let's start there. Let's start with the regenerative medicine, right? One of the things that he alluded to is words matter. Right. We have to be precise with our words.
Yeah.
And that actually got me thinking a lot about different things. But I'll give you the first word on that.
Yeah. So let's talk about that word regenerative, right? And why it might be a misnomer. So, when we do things like PRP, prolotherapy, and we're doing these kind of interventional procedures, and we use the word regenerative, what we're telling the patient, according to Dr. Malanga, is your tissues can regenerate, right? And when we think of regeneration, we kind of, patients get into this sci-fi kind of thinking that, oh, everything will go back to normal, or, my tissues will grow, my bone will grow, my cells will grow. And that's not necessarily always the case, right? When we'd like to think that, right? And I guess that's kind of how the word came along, is that yes, we might be able to see some healing, but doesn't necessarily mean it's regenerating, right? So we got to use better words. And that's why, orthobiologics is kind of a better word to use to describe the field rather than regenerative medicine or stem cells.
Yeah, I think that they're still refining that term, right? And it's still, again,
Mhm.
relatively new, although PRP has been around for a long time, but cellular treatments, pearl therapy has been around for a long time too, more than 50
Mhm.
years, and it's been working well. But because orthobiologics, it just kind of suggests that it's only for musculoskeletal issues. And there are
Yeah.
other roles of it. I mean, some people are doing it for Botox type procedures. Some people are doing it for all kinds of things, and it says that it works for everything. And you kind of can't be there either that he talked about. You kind of have to find a middle ground and look at where the evidence suggests. The whole words mattering. No, that's not a word.
Man.
um, that is an interesting concept, though. I don't think the term regenerative medicine is as bad as some people might think that I believe. I don't
Mhm.
think so. I just think that we have to be very clear when we say
Right.
that what we're doing, and I think that he did a good job explaining that. If people say, "Oh, this is going to regenerate tissue and it's going to regenerate cartilage or
Mhm.
muscle," or and that in conjunction with stem cells, that gives that perception that that's what it's going to do. So we
Yeah.
have to do a better job explaining to people, that this is not what it's doing. And he did a great job talking about how our body has an intrinsic ability to regenerate many, right? Our liver
Yeah.
does that, organ does
Absolutely.
that. Most people
Yeah.
know about that. But this concept of words and being precise with them, Dr. Joshua Wolrich, who wrote this book, Food Isn't Medicine, recently,
Mm. Okay.
I've been actually
Yeah.
thinking about that because there can be some harm. He used to have a podcast called Cut Through Nutrition, I think.
Yes,
Yeah.
I did hear
And
that episode that you sent. Yeah.
yeah. And how food is medicine can be harmful. And I've thought about that quite a bit. And I've gone back and forth on how it can be harmful. But I want to get your thoughts on what you think about that. Like, why here we are talking about that both you and we agree that regenerative medicine might not be a great thing because it gives the misperception of like what's going on. But then again, both of us have said, hey, food is medicine.
Right. I
But
think,
there can be harm from that too, right?
right. So I get it comes back to that point you just said, context, right? Context over content. That's like the theme of our lives now. George Mumford. What a great interview on
Yeah,
that
yeah,
Tim
yeah,
Ferriss
exactly.
show. But yeah, I mean, I wrote a Twitter post on that actually saying like food is medicine, and why that is that it has epigenetic power, right? We talk about nutrigenomics, we talk about the microbiome, we talk about how food has this power to regulate your entire body systems, from the autoimmune system to the nervous system to the endocrine system. And from that context, food can act like a drug in a sense, right? Like that's what NSAIDs can do, or that's what methotrexate can do, right? When you can heavy hitters or more of these benign drugs, they're affecting different biochemical processes, and that's where I was coming from in the sense that food is medicine, right? But then again, you can always take it down this other way, this other pathway where it can do harm.
Yeah. Yeah, and so I thought about that. I was like, well, maybe I should write food has medicinal properties.
Yeah.
But it doesn't. It's just, again, this goes back to my issue with this. You write these 3 words on Twitter or you post it on your story, and then somebody just reads and like, oh, he thinks that, again, probably not many people respect me, but if they do, they might be like, oh, well, Altamar says that food is medicine, and therefore I should stop taking my anticoagulation, and I'll just
Mhm.
vitamin K from
Yeah,
spinach,
more spinach.
and I'll just have more spinach, and that's going to help me from preventing getting that DVT. You know, no, that's not what we're saying.
Right.
So it is really difficult, and I can see the harm that it does. But man, yeah, I don't know. I mean, um, yeah, it's the context over content, man. And
Yeah.
what we're talking about, for those who don't know, is George Mumford. He came on Tim Ferriss's podcast. I think is episode 509, maybe. Amazing, amazing. And this is an individual who's worked with the elite of the elite athletes, the cream of the crop. We're talking Michael Jordan, Kobe Bryant, Shaq, those types of individuals, and about their mindset and getting them to be more mindful in their experience, and talked about that. So highly recommend that as well, to give you some perspective on these things.
Yeah.
Yeah.
Let's see what's next. I mean, this whole Malanga episode was awesome for me because I like as you are as me. I can't even talk right now. You're interested in doing PRP or orthobiologics, I should say, as a whole, as
Mhm.
well as I am. So for me to kind of just get my feet wet and learn about this was super interesting, right? And the best thing about Dr. Malanga is his perspective and philosophy, I think,
Mhm.
right? Because he loves to break it down to the nitty gritty so that it's very clear and understanding. And so he's very holistic when he comes, when his patients walk through the door. And you've actually been able to shadow him. So tell us like how he is in practice.
It's very much what we heard, man. It's good. He is an individual who is interested in learning all the time, right? I mean, even when I was a student, a third year medical student, I've had the fortune of working with him multiple times as a third year student, fourth year student, as a resident. And even as a third year student, he was respectful in the sense that he wanted to learn about, my background, what I had to offer. He found out that I had a strength and conditioning background, performance coaching background, and he was always trying to learn more about that. I know we talked about rehab and learning how to do a proper squat, and he knew I was an osteopath, so osteopathic medicine, how that might have a role in different type of positions. Patients. Yeah, I can't talk either. And and that's what I love, man. I mean, we talk about the practice of medicine, right? For our PM&R colleagues, that we know that Dr. Malanga is a legend in the field, right? Because he's a musculoskeletal expert. He is phenomenal when it comes to sports medicine, but he has always had the learner mindset, right? Learner's mind, and that's what it is. That's what's called the practice of medicine, because you never stops. You're always learning. You're always trying to get better, and that's what I enjoy. And he lets the evidence drive a lot of his decisions, which is what I think it should be, right?
Mm-hmm.
When we talk about evidence-based medicine and what it truly means, in the sense of how you've got the Venn diagram, right?
Mm-hmm.
And that's always evolving too. And something that he mentioned about, you and I've talked offline a lot about ego,
Mm-hmm.
and how sometimes us as physicians, myself included, 100% myself included, have a problem with ego,
Mm-hmm.
and where we don't want to say, you know what, I don't know. I
Mm-hmm.
don't know the answer to your question. Like, I am, again, that's another thing that I'm trying to make, because historically what I would say, I'm not sure, or, and sometimes kind of speculate an answer, or I try to be very clear. I don't know for sure, but I am speculating here. This is what I think might be
Mm-hmm.
having, or this is
Yep.
my understanding, and that's why I'm extrapolating this thing, to be
Yep.
very clear that I don't know for sure what's going on. And then, my thing with orthobiologics is, again, because I've had the fortune of working with him, I was exposed to this field at very early on in my medical career, and so I've been involved at looking at the literature as it's come out. And I mean, it comes out so fast now that it's hard to keep up with it. But
Mm-hmm.
so then, working with other attendings who perhaps aren't as up to date on literature, will say, "Oh no, there's no evidence for that. Oh, we got to be very careful not to work with quote unquote snake oil salesmen," right?
Mm-hmm.
Just like, no, that's not true. You got to do your due diligence, because I always go back to, again, the burden of proof is on us as physicians when our patients are suffering, and we need to provide the best possible care if we are trying to alleviate that suffering.
Yeah.
And if there's something out there that might help, then you got to do your due diligence to see if you can help the patient or not. And
Yeah.
if you know that something out there exists and you haven't done your due diligence, then you say, you know what? I know somebody out there who does a lot of this. Maybe go talk to that person if you don't have the
Right.
time, because that's a very real thing, man. Like, I'm not naive enough here to say that, oh, you know what? When I'm going to leave and I'm going to practice full time, I'm going to do all the things. No, maybe I don't have time to keep up with the literature, or if if a woman comes in and they're dealing with something with pregnancy, I'm not the best person to train you. I don't know about that. However, I know
Yeah.
X, Y, and Z. And this is why we talk about the whole developing your network is arguably the
Yeah.
most important thing,
Right.
right?
Absolutely. Yeah, I
Yeah.
mean his attention to detail, his gold standard is evident, through his podcast, Malanga Talks. And he's even written a book on like the physical exam, right? And I think we're so trained in medicine now through our intern year to kind of just let go of that art of the physical medicine, right? And I think that oftentimes carries over, right? Because you need to learn that during your foundation, right? As a medical student, as an intern. But as you get older and older, you know, it's repetition where you're like, oh, I'm sure the heart sounds are the same. Oh, I'm sure her strength is still 5 out of 5. Oh, her lungs, yeah, whatever. You know, but those things matter, especially if you're looking at a holistic approach and you want to do your due diligence and give the patient the, you know, the most excellent care that you can. So that was just, you know, evident from him during that talk.
Yeah. And I mean, again, this goes back to, you know, traditions are hard to break. Is the other thing that you asked him about is cryotherapy, icing, right?
Mm-hmm.
I mentioned when I was in high school, it's like ice is nice, how does not? Just throw
Yeah.
ice on everything. And as we learn in science, we have to, again, in science, this is why people like get pissed off about how, I don't know, 20 years ago, coconut oil was bad.
Yeah. Yeah.
Then 10 years ago, coconut oil was the best thing ever.
Yeah.
And now coconut oil is bad again. I don't know. I don't know where we are with coconut oil, to be honest with you. But the
I use it in my hair.
You know what? For that, it's good. I can promise you. No, that's just anecdote. Actually, when I was using it a lot, it was working out. But now I just don't. We digress, though. No, but you know what, man? Hey, that's what science is about, man. You know, we're always learning. We're always evolving. And I want to be the first one to say what I used to believe yesterday was not the best. Today, my thoughts are, and I want that to happen. We've talked about this is, again, one of the coaches, Mike Boyle, strength and conditioning, Mike Boyle up in the Boston area. He would always say, I reserve the right to change my mind. Mm-hmm. I steal that from all the time because heck, man, you got to be able to say. The problem is, though, we're reluctant to say, I was wrong. Right. Why do you think that is, man? Especially in our field. Why do you think that's such a problem?
Oh, the ego, man. I just think, you know, we're in competition with medical students, right? Like, so I had a professor at VCOM and she went to Georgetown, which was notorious for like cutthroat. Other medical students will find your binder, rip it up, throw it away, put it on fire. And if you were in the bottom 10 of the class, you would actually get kicked out. So like, we have been taught in this tradition that you need to compare yourself to the person to the left and right of you. And it's just ingrained in your head. And even me currently, you know, during my current rotation, I'm comparing myself to my co-intern and the senior. And I'm like, man, I'm super dumb, right? And I have to look at the big picture and say, you know what? But I have so many other strengths and maybe I have a weakness in this. Sure, I can get better at it. But like, why am I comparing myself? Right. Mm-hmm. And it's again, I talk about my tattoo that I got, and that's the reason I got it. Right. You're only a man. There's always room to learn. You are a master at something, but you're not the master at everything. And that's okay. And I just think it's ingrained in medicine, and it's tough. I mean, that's what I try to do on social media. I try to keep it real. I try to tell people like, hey, you just got to focus on yourself and that's it, you know, and help patients and do the best you can and look at the bigger picture of life, because medicine can consume you like that, as we both know.
Yeah, for sure. So, man, before we close out, let me ask you this what advice would you give either your colleagues or maybe actually even for you? Because like you said, you just got your feet wet in the world of orthobiologics. Or if patients ask you about orthobiologics, what advice would you give them in terms of, they say, hey, doc, you know, I've heard of this concept of regenerative medicine, or, you know, I've got this knee issue and I've been thinking about PRP. What are your thoughts?
Yeah. So context over content, right? So what is it for, right? So we got to go through it all, right? What is a patient looking for? What are their goals, right? Dr. Malanga talks about, well, if they want that real quick fix and there's nothing you can do about it, maybe they got to go through surgery, right? But otherwise, you go through risk and benefits. Hey, this is what surgery will do for you. These are the complications. This is PRP. This is what it'll do for you based off, you know, who are you seeking to go to? If I don't know something, that means I got to go and look it up. And like you said, if I'm not willing to do that, send it out to the next best person. But from there, it really comes down to the papers, right? We talk about the PLRA classification, how different people doing PRP are doing different things, and that has a big effect on kind of the complications or the effectiveness of PRP. So I think, you know, for me personally, and for those, there's a huge boom of people going to PM&R, as we know. start reading about it, start learning about it. Ask your program to get an ultrasound course, ask your program to bring speakers on for didactics. That's what I'm trying to do. I think, programs are willing to listen. PM&R is one of those fields that every program is so different, right? Some people are really good at brain injury. Some are good at spinal cord. Some have great ultrasound training. There's going to be deficiencies and there's going to be strengths, but as if you can bring up those ideas in such a new field and connect with others, I think it makes it easier as you kind of go down the road, PGY3, PGY4, and then fellowship and onwards.
Right on, man. I love that. Yeah, I would just add on to that is for patients who are interested for their own musculoskeletal ailments, what I would say is be careful what you read, be careful what you hear, because nowadays it's just about who's got the loudest message that gets across, and sometimes that can and he talked about the beautiful baby in the dirty bathwater, right? And that's, I think, part of the reason those individuals that I had mentioned who say, oh, we have to be careful not to be snake oil salesmen, and they mean well. We all have good intentions. There's just a few bad apples, right? They're ruining it for everybody. And so for the patients, because again, the signal's out there. There's a lot of misinformation out there. And the internet can be a powerful thing, and you can get it. It's just knowing where to look, knowing who to ask, the right person. And, that's the challenge. Hopefully, a lot of great resources. He mentioned Interventional Orthopedics Foundation is a great resource. American Medical Society Sports Medicine is amazing for this. American College of Sports Medicine probably has some as well. I would look for reputable resources in the field of medicine. PubMed. Right. PubMed is a great resource. If it's an article, you can kind of try to read more into it. Not everybody's trained to do that, but those are some of the things that I would mention for my colleagues who are in musculoskeletal medicine and even not, is if this is an area of interest, it can be done. It's again, the papers are out there. The evidence, I would say, is very strong for some specific ones, like lateral epicondylosis. He talked about tennis elbow is a very common thing. Knee arthritis, some good stuff is coming for greater trochanteric pain syndrome, which is historically known as trochanteric bursitis. It's not really a thing now, as we know. You guys can do it. Like, we can all do it too. And if we don't have time, then again, that's where we refer out. That's where we say, hey, this is a better person. And to your point about what specifically did they have done, if a patient comes and they say, I had this done, we really got to ask them. We have to be very precise about the diagnosis that was made, but also the treatment. So kind of what you alluded to is his analogy. Actually, I'll steal it from him. Is he used the fertilizer analogy, right? With PRP. If you don't put enough fertilizer, the lawn is not going to be green and beautiful. And that's saying not using enough PRP, right? Not using enough platelets.
Right.
If you use way too much fertilizer, now you just got a bunch of crap on the lawn. Literally, it's all brown.
Right.
Nobody wants that either, right?
Yeah.
If you remember, that is efficacious dosing. That's the same thing with nutrition, supplementation. That's what it is, right? You don't use the right amount of dosing, it doesn't get better. You use too much, the dose makes it poison. It can become harmful as well. So that's the last thing I'll say on that, man. And I think that we've probably talked people's ears off at this point. Any last word, man, that you got?
No, man, just here it is. We recapped episodes 12, 13, 14, and a must listen not only to the patients and the lay people, but also the practitioners out there, because I think we can all learn something from these two amazing people, Dr. Aerni and Dr. Malanga.
Sounds good, Ben. See you next time, man.
All right. See ya.
Well, guys, that is a wrap on the show. Thank you so much for listening. Hopefully this was informative for you. By the way, don't forget to reach out to Panacea Financial. Panacea offers loans just for physicians and medical students with low rates, free checking with no ATM fees nationwide, and 24/7 live customer service. Visit panaceafinancial.com today to open your account and join a bank built with you in mind. Panacea Financial is a division of Primus, member FDIC. And as always, guys, remember that important disclaimer that everything in the podcast is for educational purposes only. It does not constitute the practice of medicine, nor should it be construed as medical advice. No physician-patient relationship is formed, and anything discussed in this podcast does not represent the views of our employers. However, if you enjoy the show, please be sure to subscribe, review, and share with anyone who you think will gain value from this. Until next time, guys, thank you so much for listening.